How are cystic fibrosis blood samples analyzed? Have you ever wondered how blood samples are analyzed for cystic fibrosis? This process is crucial for diagnosing and monitoring the health of individuals with this condition. Blood samples related to cystic fibrosis are primarily analyzed through genetic testing and newborn screening assays. Let's break down the key steps involved. First, newborn screening is often the starting point. The initial blood test for cystic fibrosis in newborns measures the level of immunoreactive trypsinogen, or IRT. This is a pancreatic enzyme precursor that tends to be elevated in infants with cystic fibrosis. The test is performed on a dried blood spot collected shortly after birth, usually between 24 and 48 hours of age. Healthcare professionals collect this blood on specialized filter paper, ensuring it is air-dried properly for accurate results. If the IRT level is elevated, a second test is conducted on the same blood sample to detect mutations in the cystic fibrosis transmembrane conductance regulator gene, commonly known as the CFTR gene. Next, genetic testing plays a vital role in confirming a diagnosis. Blood samples, or sometimes cheek swabs, are analyzed to identify mutations in the CFTR gene. Everyone has two copies of this gene, and cystic fibrosis occurs when mutations are present on both copies. Testing panels typically check for the most common CFTR mutations, which can range from 30 to 139 different mutations. In cases where initial tests are inconclusive, or if there is a strong clinical suspicion, full gene sequencing may be performed. This genetic analysis not only confirms the diagnosis but also helps identify carriers and guides treatment decisions based on the specific mutations found. Beyond diagnosis, blood work is essential for monitoring the overall health of individuals with cystic fibrosis. Regular blood tests help assess nutrition, inflammation, and organ function. These tests can include evaluations of liver function, pancreatic enzymes, and other markers relevant to cystic fibrosis complications. In summary, blood samples for cystic fibrosis are analyzed mainly through a two-step newborn screening process, starting with the IRT assay and followed by CFTR mutation testing if indicated. Genetic analysis from blood confirms diagnosis and informs personalized treatment. These blood-based tests complement sweat chloride testing, which remains the gold standard for diagnosing cystic fibrosis. Proper collection and handling of blood samples are critical for accurate results. Always consult healthcare professionals for personalized advice and information regarding cystic fibrosis.